Doctors of Reddit, what's your thank god they came in for a second opinion moment? Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanimous. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this. Time. Perceived cost. History of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I'm not a doctor, but I'm glad my parents took me in for a second opinion when I was complaining about a bad headache when I was 15 years old. I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus and that I should just rest and take meds. I went home, laid down and took some Advil and carried on with my night. Around 1 AM, I was screaming on the floor. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he'd done goofed and that I would be talking to our mutual chief of clinical services about the incident. Edit. 1. Thanks for the silver. You all rock. ER nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. Can I go ahead and speak on behalf of my doctor? 19M at the time, 33 now. I felt sick for about a week. Flu-like symptoms. Didn't want to eat. Just felt bad all over. One day at work I feel a very uncomfortable cramp tear in my abdomen. So I go to one of those 24-hour clinics. At this point I'm slumped over. Can't stand up straight without insane amount of pain. Just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones. Go home. Drink fluids. Sleep it off. This seemed fine to me. I was ready to go home and listen to the doc. All was good. But my girlfriend at the time didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER. Against my wishes, of course. After a few minutes at the ER, they determine my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital. So the recovery kinda sucked. Now I just have a crazy 6-7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. Edits. More info. Medical terms. etc etc. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctor said the replaced hip was fine. We finally made her go to a private clinic in my hometown. And the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation. And there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. I was like 10 and my parents took me to the doctor cause I thought I broke my leg skateboarding. He said it was a 3rd degree sprain, told me it'd be fine. I pointed out lines in the x-ray and he said there were nothing. I somehow convinced my mom to take me somewhere else and they confirmed I had multiple hairline fractures in my growth plate. Wife went to ER for pain in her pelvic region. Ultrasound showed a mass. Probably an ovarian cyst, they said. It will pop in time. Leave it alone. Went to THDR about a week later. Had a surgery to pull it out maybe a month later. Did a biopsy on the mass. It was ovarian cancer. She is now cancer free, but WTF. I got a moderate traumatic brain injury in October, and the week after I got home from the hospital I wasn't acting like myself, was refusing to eat, and just didn't make much sense. My mom called the doctor a few times. They said it was normal but to take me in if anything changed. She took me in on the Saturday a week later because I started slurring my speech and was unsteady on my feet. The injury caused my sodium levels to drop from 140, normal, to 119. This in turn caused stroke-like symptoms, which were in reality a series of small seizures. Not a doc, but a nurse. At a clinic, a lady came in for breast pain with a lump. I was in the room for the exam for safety of everyone. The doctor told her it was a sprained muscle and to go away. When he left the room, I told her the name of one of our other doctors that specializes in women's health. Told her she could not let this go. She saw him and he referred her for some radiology, and that's how they found her breast cancer. She later told us all this in a sweet card she sent, telling us if I hadn't told her to advocate for herself she may not have followed up. Edit. Wow, my first gold ever. Thanks so much, friend. Edit. OMG, 2 golds. Wow, thanks again. If anyone can take something from this, just advocate for yourself and your families in healthcare matters. Sometimes you have to make them see it. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. This is a I wish I had gotten a second opinion story. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency. Where I had gone initially, and lost 60 pounds for no reason. It was only a year or two later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. Not a doctor, but have had a second opinion save my PP. Noticed blood in my urine and went to family doctor. Family doctor said it was a normal injury and would go away. Went for a second opinion with a urologist, and after a bunch of tests they found scar tissue built up in my urethra that was causing inflammation and if left untreated would cause the urinary tract to close. So they removed the scar tissue and I about cried while peeing for weeks after, even while on pain medication, until it healed. But at least I could still pee, and that was thanks to the second opinion. This is my second story to post here, but a great story no less. Mid-30s man walks into my office with what looks like a black eye and a broken blood vessel in the front of his left eye. He went to his primary and it was simply assumed that he got punched or hit or something. And he was dismissed. He was noted to have high blood pressure. But a script for medicine was written and a follow-up in a few months. Gentleman comes in to see me to get another opinion on the matter, and I look at him and immediately start the line of questions. How long has it been there? Do you have a headache? And when you plug your ears with your fingers, do you hear a whooshing sound? He had a cavernous sinus fistula, CCF. I sent him directly to the emergency room with his family of 4 in tow, and he was in the OR within an hour of arriving. Saved his eye and possibly his life that day. The best news, he was a kitchen guy at my local diner which I frequent, and they still treat me like royalty there when I come to eat. They all remember the time I saved one of theirs. Former ER volunteer here. An elderly gentleman was brought in by his concerned adult children for chest pain. He wanted to believe his primary doctor that it was just some gas or heartburn. But his son just had a gut feeling and made him go to the ER with everyone so he could get checked out. Heart attack was imminent. We weren't sure if treatment would take effect in time to prevent it. Declared code blue. All hands on deck. Place went from a quiet, empty ER to sheer chaos in a few minutes. There is no doubt in my mind that that gut feeling saved his life. not a doctor. And this isn't about a human. On New Year's Day, 2 years ago, our little hound dog would not get out of bed. Her back half was unresponsive, and she would yelp in pain if anyone touched her. We took her to the emergency vet, the only place open to get care on the 1st of January. We were there for 6 hours. The place was a madhouse. Eventually, doc checks out our pupper. They take a bunch of x-rays, and the doctor tells us that there are no breaks, which means there are likely lesions on puppy's spinal cord. And our options are either very pricey surgery and a significant quality of life decrease, or put her down and save her the pain. They give us some pain meds for her, and we take her home to think about the options. The next day, we get into our regular vet's office. Dog is still limping and heavily favoring a leg. Regular doc inspects Poochie and asks what other doc said. After hearing ER doc's prognosis, regular doc advises us never to go back, and informs us that our dog likely banged her knee really hard on the bricks of our porch and was just being a baby about it. 2 days later, doggo is 100% fine. Military doctors suck. Ask anyone. For the past 4 years, I've had abnormal pap results. Each year, they told me it was fine and that it hadn't grown or become worse. But no one would look further into it. They insisted I didn't need any opinions. Since I've been busy with life and work the past few years, I decided they were right. 'Cause I'm an idiot. Finally, my new doc saw the results and became immediately concerned. She asked if anyone had told me to do a biopsy. I explained what the previous docs told me. She shook her head and booked me an appointment with the Dysplasia Clinic ASAP. Turns out I had cancer cells that, while not fully bad, put me at a high risk for cervical cancer in the future. They performed a LEAP procedure and successfully eradicated what could have developed into something much worse. I'm so thankful to my doctor for knowing what was up and taking action. She's awesome and I'm going to be sad when she PCS. A bulk of my career lately seems to be maligned patients with legitimate medical issues who've been labeled as hypochondriacs and sent through for a psych workup and meds counseling. People with histories of all kinds of endocrine issues, like thyroid cancer, thyroidectomy, patients who see someone once every 2 years about their thyroid and never have labs checked or med dosages fixed, or diabetics with poorly controlled sugars, people who've had bowel surgeries and take time release meds, and then wonder why they aren't working. The piecemeal system of healthcare in the US is really doing such a disservice to actual humans. So many specialists and no one piecing together the big picture. This woman came in through the emergency room with a chest pain. She visited her GP 2 times already, Monday, Wednesday. He treated it locally with subcutaneous anesthesia injection, lidocaine. Turned out she had huge myocardial infarction. As we told her what we think it is and that she needs immediate coronary intervention. The stress caused further contraction of the closed coronary vessel and she had asystole right there. After 2 minutes she jumped back on and we could eventually save her. Although her heart was damaged after this. But the follow-up showed improved heart performance. So she got that going for her. Which is kind of nice. From the time I was 13, I had a growth on my thumb. It became so big that it affected my piano playing. I went to the doctor about it, and he diagnosed it as a wart that had been there for nearly a decade. He used acid on it. That hurt. And did nothing. He used an electrical instrument to burn it. That really ducking hurt. And again did nothing. I moved to the UK and was at a dinner party a friend was hosting. She was a nurse, and many of her friends were nurses and doctors. One of the doctors, a surgeon, saw the wart on my thumb and became very excited. He called to his wife, a nurse, to come see. He told me that he couldn't diagnose me because I wasn't in clinic, but to make an appointment with my GP. I did, and was diagnosed with a neurofibroma, a type of tumor that develops around a nerve. I had surgery to remove it. It was the size of a lima bean. Thankfully, It was benign. But no wonder the wart treatments hurt like a son of H.